Everybody, thank you for taking the time to come here today. This is actually very important. It's important to get the message out because in New Jersey right now there are 900,000 New Jerseyans out of 8.8 million that don't have access to health insurance. And for those of us who have worked on the budget, a number of our colleagues here today have, and we'll hear a budget address this afternoon, we know that the second largest employer in the state is hospitals and healthcare providers. And that we turn to them time and time again to care for this 900,000 people that are uninsured, but really without the dignity of going to a doctor like you and I do. I will tell you, I literally came from the dentist chair today to this press conference. And we take for granted the access to that type of care that is so fundamental to day-to-day health care. When you have a baby with an ear infection and you can't get to a pediatrician and your pediatrician becomes the emergency room doc, that's not quality health care. When we have focused in the past on experimental treatments like doing mobile vans in communities around St. Clair's Hospital, and we would hear the success of families saying, my child was sick, but I didn't run to the emergency room because I knew the mobile van and Nurse Betty was going to be in our community tomorrow, and that we could see them directly, and the difference that that made in the dollars that were going into the emergency rooms, but in the quality healthcare outcomes that we saw in the community. We have been experimenting until finally this opportunity has presented itself. We need to make the public aware that they have access to this insurance. We need to make the public aware that it's easy to access. We need to make the public aware that it will make a difference in the quality of health care for themselves and their families, and that this is the future. It is a remarkable opportunity. We want everybody to know that the deadline is March 31st. There are 3 ways to enroll. It is online at healthcare.gov, by phone, or with in-person assistance. Whatever is most convenient for them. This is critically important. It will help save and secure our hospitals financially. It will provide jobs in the community, but most importantly, it will provide quality health care for the residents that we care about. It will make them healthier. It will make them more vibrant. It will make them more successful so they can care for their own families. If you're not worrying about your health care, your children's health care, it's easier to go out and help find a job and to take care of your family in a very meaningful way. There are so many ripple effects to this that are so critically important. We are very blessed to have this opportunity. We need everybody working together off of these successful programs, and we're very excited that you're here to join us.
Good morning, everybody. I think it's just absolutely huge that there is affordable and accessible health care. I think that is very progressive and essential to a good quality of life and a decent society. My office is located in the city of Trenton. We are located in the city of Trenton because most of the people who represent the voiceless and the neediest live in and around these older urban centers. We've been trained to do a number of things, whether or not it's Jersey Shares, LIHEAP, or whatever else, and we're prepared to be able to do this also. That this is a very creative way to do that. 40 legislative districts. I hope we have the 120 legislators all on board in their respective districts, willing to give assistance, direction, fill out a paper, sign a paper, send in whatever information, or use our computer access to get people enrolled. I'm at 226 West State Street, right in the capital city in Trenton, and our number is 609-292-0500. So if you need help to get access to affordable health care, you come to us because we will help you to the extent that we can. And I thank the organization for giving us the opportunity to share this information, and I thank God that He's given us the opportunity to put together such a creative mechanism for the people. Thank you.
It may often seem like there's so much information out there that it may seem like overload. We're here today to say how simple it can be, whether it's making a phone call, whether it's going on to healthcare.gov, or calling one of your legislators' office so we can help you find a place to get assistance in person. But I also want to talk to those that do have health care, because oftentimes you might be a caretaker, or you might have that family member that isn't covered. We all have family members that look out for others. You might be a mother, a father, that aunt or uncle who looks out for your nieces and nephews. It could be your sister or your brother. I know in my family, we do that. We look out for each other, and I'm sure your family does the same. I'm asking you, even if you have insurance, please talk to all your family members. It could be that neighbor, it could be your coworker that might be struggling, to let them know that quality health care and getting that insurance you need to have that access to health care is just a phone call or a visit to online or coming in person to your legislative office to find out how to get help. And I want to say a particular thanks to our navigators, because it can seem overwhelming. But there is in-person help. Well, they will walk you through the process. No matter what questions you have, there are answers. So please do not hesitate to get help, because it means a healthier future for yourself, for your family. And we can all know that that family member or friend, when faced with a medical decision, who are concerned about whether will this be that medical case that bankrupts me. Well, you don't have to worry about that anymore. With healthcare, through the ACA, and by signing up through healthcare.gov, you can have insurance to make sure that you can sleep a little bit better at night, to have that preventative care, and when those emergencies arise, not have to worry about whether you have to bankrupt yourself and your family. So please, get covered, and if you have coverage, talk to those that aren't covered about getting it. Thank you so much.
Thank you very much, Gene. That's wonderful. In that 900,000 people, as Majority Leader Greenwald said, that New Jerseyans are eligible for health care, and March 31st is the deadline. Out of that, 100,000 come from Middlesex County and Somerset County. And organizations like Enroll America have done a fantastic job in reaching out and letting people know, even though it's available, how do you get access to that, and training them, holding their hands, and making it available to them. This journey for universal care started with President Teddy Roosevelt and President Barack Obama, who has the courage to stand up and say, it has to be done. This is what I would like to do. That's the only thing if I can do. And unfortunately, Affordable Health Care Act had two things that slipped out. One is it should have been a single-payer system, and there are about 10 million people who are left out in the donut hole. Many of them happen to be Hispanic Americans who live in my district, in the 17th Legislative District. I have teamed up with N.J. Perg, and on the footsteps of Rutgers, we were able to make an announcement so that way people, the students who are eligible, can get insured. And so this is an important thing that what we are doing, and I want to thank my colleagues in the legislature. I also want to thank Assemblyman Herb Conaway, with whom I teamed up, and we created the Health Information Technology Commission, and subsequently legislation to create health information exchanges, along with Assemblyman Herb Conaway, as well as Assemblyman Singleton. Unfortunately, the governor vetoed that legislation. But one of the key things about Affordable Health Care Act is that even though we provide the best health care in the world, almost the best care, the cost of delivery of health care is very high, because of the people who are known as frequent flyers, who end up in the emergency rooms, and which emergency room care is neither emergency nor care. And at the end of the visit, they will tell you, go and visit your primary physician. If I had the primary physician, why would I go to emergency care? This Affordable Health Care Act provides them the access and availability so that way they can get insured. And there are many, many stories. I have a friend who was in Japan who had pre-existing condition. She could not come into United States until 2014, when this pre-existing condition clause got taken care of. We have lifetime cap issues, and children under the age of 26 to be covered under their parents' health care insurance. These are all very critical. And I think as legislators, as public servants, we have to speak for those people who cannot speak for themselves. There are people who have language barrier, whether they are speaking Spanish or some other language. We need to speak for them. I think that's why I feel that this type of press conference and letting people know there is help available. March 31st is the deadline. Thank you.
Good morning, ladies and gentlemen. A lot has been covered already, so I will be brief. Today is really about turning obstacles into opportunity. No longer is it a financial piece that is worrisome anymore, because there is grants and incentives to help people there. And it's no longer about notification, because today we're beginning that effort and that message and making sure it gets out. Assemblyman Conaway and myself had the pleasure of hosting an informational in our district on Dr. Martin Luther King Day, and how fitting that was for us to try and provide access and information about health care to the many residents of the 7th Legislative District. We will continue in that endeavor in our offices in again, Burlington County, to make sure that folks are aware of everything that the Affordable Care Act can do for them. So again, if there's one message that we would hope that's carried forward to everyone, March 31st is the deadline, and there are no more obstacles to health care, just opportunity. Thank you.
Thank you. Well, I've spent 20 years advocating for access to health care. So it's finally time that we have this opportunity. So everything has been said about how to approach this. This is the end of the open enrollment period. So it's not the end forever, but the open enrollment period ends on March 31st. So I ask you to ask your friends and neighbors to join with us, to take that step, just to look at the information and make your own decision. And I'm sure if you do that, you'll see that this will benefit everybody so that they have access to health care. And as Assemblyman Greenwald said, and many of the others have said, we're going from having the higher cost of treating diseases after the fact because we haven't taken the time to address and make access that primary care. So this is going to give everybody that opportunity, and I'm very proud to be able to offer our legislative district office to be able to help people get enrolled. Thank you.